As a member of parliament representing 6.5 million Kenyans with disability, I've written to the CS in charge of health, Mutahi Kagwe, that this information that you are disseminating to all Kenyans regarding the coronavirus menace should be accessible to persons with disability. We have our brothers and sisters who are visually impaired. They are blind. All the print medias, posters you have so far disseminated does not contain braille. Hence, those who are blind will not be able to know what you are talking about. I've also told them whenever they have a media briefing of the coronavirus, because I've seen they are now having media briefing daily, telling us they have one case of coronavirus and assuring the nation that they are well prepared, telling them that in Mbagathi, telling our Kenyans when they detect any signs and symptoms of coronavirus where they are supposed to report such cases, the hotline, but I have not seen sign language interpreter. That information have so far not reached the deaf community. And there are 1 million Kenyans who have hearing impaired. We have 1.2 million Kenyans who are visually impaired, who are blind. Mr. Mutahi Kagwe, I want to tell you, all the media briefing you have been having, the blind have not been able to follow. The deaf have not been able to follow because you did not have a sign language interpreter. All the posters, all the written communication, the messages you have been sending, the blind have not been able to get that information. They don't know where to report to. They don't know the signs and symptoms of coronavirus. They don't know how coronavirus is transmitted from one person to another one. They don't know there is a case that have been detected in Kenya. They don't know that that case was in Rongai. They don't know that you are following the contacts of that case. They don't know there is Mbagathi wing of Kenyatta National Hospital where there is isolation ward. They don't know there are isolation ward in every county. Let us have partnership between the National Council for Persons with Disability and the leadership of persons with disability together with the Ministry of Health so that we can develop a very unique and customized formula of passing information to persons with disability. Because nothing about us without us. We know ourselves, we know which information will be able to reach us, we know which one will not be able to reach us. And again, if you leave us behind, we may end up becoming the conveyor belt of the virus. Because if you don't get information of how the virus is being transmitted, if you don't get information of how we should be washing our hands, how we'll be wearing masks, then we will, as persons with disability, will be a conveyor belt. Please urge our president, together with the government, to also protect our beggars with disability in the streets, and not necessarily even with disability. Any beggar who is in the streets, they are receiving money from Dick, Tom and Harry, and some of this money that they receive is not sterilized. We don't know the originator. Probably it may eventually become a conveyor belt. And that is why we really need to sit down and have a conversation. Let us also have a way of protecting them, because they may die in the streets, but even when they die, they have already become a depot to coronavirus, where it will maybe spread.